Assalamu alaikum. My name is Naseem and welcome to the channel of The Cool Principal. So students, today we are going to learn how to insert nasogastric tube. So let's look at the aims. The first aim is to enable to drain gastric contents. To obtain the specimen from the gastric contents, it will allow to the drainage and the lavage and in drug or in tube feeding. And in trauma setting, NG tube can be used to aid the prevention of vomiting and aspiration, as well as for the assessment of GI bleeding. The NG tube can also be used for feeding. Let's look at the equipment. Personal protective equipment, NG tube, 60 ml syringe, 2% xylocaine jelly, adhesive tape, drainage bag, stethoscope and a cup of water. Assalamu alaikum, Mr. Ali. How are you? Mr. Ali, I am going to insert NG tube. So, do you allow me to pass the tube? Thank you very much. Mr. Ali, I am going to tilt your head. Please be with me. So, examine the nostrils for deformity, obstruction to determine the best side of insertion. Measuring tubing from bridge of the nose to earlobe, then to the point halfway between the end of the sternum. You can mark with the marker or you can highlight that point. Lubricate 2 to 4 inches of tube with the xylocaine jelly. Pass tube via either near posterior, pass the pharynx to the esophagus and then to the stomach. Instruct the patient to swallow the tube. Mr. Ali, please swallow the tube. If you will see any resistance, rotate the tube slowly to the downward. Do not force the tube. And you can also withdraw the tube if you will see any changes in the patient respiratory status. Pass the tube until the mark is reached. Clean the area if there is any secretions. Then use the adhesive tape to secure the tube. If for section, remove syringe from free end of the tube, connect to the suction. Set the machine on the type of suction as the pressure prescribed. Document the reason for the tube insertion. Please note down the type and the size of the tube and the nature of the amount aspirate and the type of the section of the pressure of setting and the nature of the amount of drainage and the effectiveness of the intervention. Removal of nasogastric tube, flushing with 20 ml water or normal saline. Dear student, please remember this is for the adult patient. If there is a child, you please make it 5 to 10 ml. Then remove the adhesive tape. Rotate the tube so to assure that it's moving freely and then pulling slowly and steadily and remove the nasogastric tube.